It's time now for... I'm sorry, what was that? I don't understand.
I said I want to ask the dentist.
Ask the Dentist, brought to you by Mill Creek Dentistry. Mill Creek Dentistry. We get dentistry done.
All right, welcome back to Health Matters Live from Aquasox Stadium before the Aquasox Spokane Indians game. Dr. Bill Mulliken and Sam joining us today for the Ask the Dentist segment. How are you?
Good. Good afternoon.
Do you come to a lot of games?
We come to a few.
Oh,
Sam likes to come. You know,
Yeah.
It's great for kids here.
It's fun.
Yeah.
It is a great venue for the family. I mean, it's always impressive. Hey, Dr. Bill is with us tonight, and we want to talk about mouth guards, and particularly let's talk about sports mouth guards. And before we get going, describe what a mouth guard is and what we're looking for in mouth guards.
Well, we're wanting to cover the teeth and protect them certainly from impact sports for the most part, where you've got a ball coming at you or certainly not a bat, but anything
Hopefully
that's coming in at your mouth, and to protect them and protect your lips and the soft tissue also.
Right.
So it used to be just for football, because I remember when I played football, we'd go to athletic supply and get the one and put it in water.
Right.
But now they wear it for you wear mouth guards for baseball as well.
Oh, baseball, lacrosse. I mean, basically any sport, and the more you can wear them, the more teeth you're going to protect.
So mostly we're talking about contact sports or any kind of sport where the teeth can be hit or the mouth can be hit. Is there a certain age where you start recommending kids start using mouth guards?
Well, gosh, Sam here is playing some flag football this year, and gosh, they have him wearing mouth guards. Now, at least gets them used to it. They're not allowed on the field without them, and so, gosh, he's 5, so yeah.
So I mean, 5 years old and up probably start wearing mouth
Sure,
guards.
sure. Even for primary teeth, I mean, it's going to, like I say, it keeps you from, putting a tooth through the lip also, which is pretty painful.
Right. So there's been some research. I don't know. Do you know anything about the research being done on mouth guards and preventing concussions?
Yeah, it basically, when you get a blow that causes the lower jaw to slam against the skull, that's quite a concussion excuse the pun, that will radiate up to your brain. So having a cushion in between there really helps.
So preventing the upper and lower jaws from slamming together, decreasing that shock to the brain, might prevent concussions. So how should I choose if I'm thinking about I have to get a mouth guard for my child? How should I go about doing that?
Well, the main thing is you want one that they're going to wear and they're going to use. And so the comfort is really important. Now, the ones at the drugstore or the sports stores, they work fine. They may take some fiddling around with, and if you get your Dremel out and make them fit, because all mouths aren't the same. And that's one advantage of going to your local dentist, is that custom fit them. They're going to be made directly so they'll fit well, and if they fit well, the kids are more likely to wear them.
So when you custom fit them, you actually make a mold of the upper and lower teeth, or just the upper ones? I mean, does it depend?
It depends, but normally we'll take an upper and lower mold, and then that's made into a stone model. Then we can fabricate a mouth guard on there that's really going to fit well.
And what about these kids that are in braces?
Braces, we can fit right over the top of those, you bet. And that's where you really need to see your dentist, because that's to get one to fit over that without pulling off your braces after heating them up could be a problem.
And does insurance cover that if you're getting them custom made?
Normally doesn't.
Okay, so what does that normally run?
Between $150 and $200.
And this is something they would have. It wouldn't just last like one season. I mean, this would be something you'd have for a while, right?
Sure, if they have all their permanent teeth, it will. And that's one thing about certainly somebody Sam's age, maybe go ahead and get one at the sports store, and then
maybe something a little less expensive to start out with.
You bet, because they're going to be losing teeth at any rate until they're 13, 14. So,
do these mouth guards have a shelf life? I mean, are they good for one season? Do you recommend them changing them out after so much use?
Well, kind of look at them. I mean, you want to get in there with a brush and brush them out and make sure they don't get as grody as the socks in the bottom of the
Okay. Now, is that an official dental term, grody?
That's right. I learned that in dental school.
Okay, good.
Exactly. First semester. Here, you make a good point. Here's the deal. My son plays hockey, and they wear mouth guards, obviously. These kids take off the guard and throw it in the bottom of their bag with the dirty socks and the dirty shin pads and all the equipment. How often should they be cleaned?
They should be cleaned after every use. Yeah,
okay, there you go.
Yeah,
so they don't get grody.
Yeah.
When the mold, when they start turning green, that's a bad sign.
That's a good point. Yeah. So here we go. I want to get back to the braces because these kids wearing braces. I mean, it's important that they cover the upper and lower areas of the mouth.
Yeah.
Because if they get hit, those braces can dig in and cut the lip pretty bad, can't they?
Some nasty lacerations. Yeah, and then that's, so you don't want that.
Okay, so I want to know here. In all these sport magazines, you're seeing these Under Armour and these performance enhancement mouth guards coming out. Is there any truth to that? There
is actual scientific published reports that it really helps. It increases your stamina. It decreases your reaction time.
What does that even mean? What's a performance mouth guard?
Well, performance mouth guard is one that it's similar to a mouth guard, but it doesn't have to, even for non-contact sports, it can be in place. And basically what it does is when you clench your teeth, it releases cortisol, which depletes your reserves for your quick twitch reactions. And so it prevents that or slows that from happening. It makes your endurance quite a bit longer. And a lot of sports stars are using them.
I'd never heard of that before.
Yeah. I think if I remember, I read something at the end of last season. The New Orleans Saints all went out and the whole team, I think, had those performance mouth guards.
Yeah, they do. There's a lot of professional athletes, and none of those guys are actually paid. They don't pay anybody to use those. They're using them because it really makes a difference.
Okay, so here we got to ask this question because this comes up a lot. Here we are at the baseball park. So your little leaguer's out playing baseball. Unfortunately, takes a ball to the mouth, knocks out a tooth. What is the best way to care for that tooth so they can get that tooth preserved into you? So you can replace those, can't you?
You can reimplant them.
Okay.
And in fact, they can be reimplanted on the spot if it's not, if it didn't fall in the dirt, if it just fell on
the coach just picks the tooth up and just
rinse it off.
You bet, and just place that back in. If you aren't comfortable doing that, again, if the tooth, rinse it off in some saline water or milk, and even placed along the tongue if the child's old enough to do that, or in a glass of milk. And bring it on in and get in as soon as you can, because the sooner we can do that, if we keep those cells alive, it can get reimplanted and take.
And so what I've heard you shouldn't do is you shouldn't take the tooth and rub it or cause any kind of abrasion on it.
You don't want to scrub it. Yeah, just a gentle rinsing.
Just a nice, easy rinsing. And the reason you don't want to scrub it is because that those ligaments and the cells you're talking about?
The ligaments are living on the root and then, of course, back in the socket. And so if we get that back in soon enough, those can reattach. You're likely the tooth is going to die or need a root canal, but that's okay. We can handle that.
Yeah, it's better to get the tooth back in and do the root canal and have the original tooth in.
Oh, absolutely.
Interesting. More, you ever lost a tooth? That's one thing I haven't heard you talk about.
The night's young, so no,
That's right.
I haven't lost it. I haven't lost a tooth. So if you can't get it in, then you replace the tooth, then, right?
Right.
Implants. You have the implants.
We can do either an implant or a bridge, and these days the standard of care is definitely a dental implant, which is going to replace that tooth singly. So it'll put a titanium root up into the bone, and you're set.
Do you see a lot of this?
A fair amount. In fact, I don't see as much from organized sports anymore because the requirement is to wear the mouth guards, and so that's great.
And a lot of times in baseball too, even the softball players, the women's softball programs are starting to wear the full batting cage.
Yeah,
and that ball's coming in there fast. And
I've seen those girls pitch.
Because I played softball with this guy who was playing shortstop and took a bad hop and broke his jaw.
Oh yeah.
But a mouth guard taking a bad hop, that's the chances of you getting your teeth knocked out. It's not going to happen, right?
It should not happen. It'd be way less. So I see a lot more swimming pool accidents, skateboarding accidents now that we have the reimplant teeth.
Wow.
Well,
by the way, also if you just chip the tooth, find that chip.
I was going to ask you about that's why I was mentioning. So let's talk about that. So if you just chip the tooth, find the chip, and the reason you want to find it is why?
We can rebond that on, and it's going to look the best.
Really?
Yeah.
So instead of making what do you call it, a cap or a crown?
We can instead of using something artificial, we can bond that piece back on. So
what kind of care if you can find the chip again? Is it just put it in water or saline or milk?
Saline or milk. Try water. Well, if it's a chip, that's fine. Water's fine. Just keep it hydrated.
Right. Okay. Keep the chip moist, and then is there a time frame that the chip can actually be rebonded? I mean, is it within 24 hours, 48 hours? What works?
That can go, a little bit longer. I mean, we go 24 to 48 hours, and just get it in as long as there's not bleeding from the nerve of the tooth there.
And does it change if it's your front teeth? You know what I mean?
No.
I mean, if it's your back teeth, it's probably easier to match and everything than your front teeth. Is like they're on stage.
Yes,
you know what I mean?
Understand. Yeah,
Okay.
yeah, definitely.
Cosmetically,
Yeah.
Better to look good in front and don't worry about the
Yeah.
big ones in
That's
back.
right.
Yeah, there you go.
But I'm guessing that a percentage of the teeth that are knocked out are in the front anyway, right?
Yeah. With it, pretty rare anywhere back from the bicuspid back. Everything's going to stay there pretty good.
But like you must just look at these hockey guys playing hockey and are just amazed. Do you ever see those guys that just have just two teeth?
Oh yeah, I mean,
You should move to Canada. They need you in Canada, dude.
That's what they eat with. Those
Yeah,
two teeth. That's what they eat
I'm not kidding. And what's up with England? But I guess that's another show, right?
yeah, that's a
another
whole
show.
nother.
Okay.
So in closing, kind of summarize this. Any contact sport, good idea to wear a mouth guard. If the child's fairly young, probably over the counter, those ones you can buy in the sports stores. But as they get older, custom fit, they're probably going to wear them more. They're going to be more comfortable.
Yeah, and there's just more chances when you get the ball's moving faster when you get a little older. So be prepared.
Cool.
Right.
Are you going to stay for the game?
I think we are.
Awesome. Have a
Yeah.
good
Can I have
time.
a hot dog?
Yeah. Oh yeah.
Enjoy more.
Dr. Bill Mulliken from Mill Creek Dentistry. Thanks a lot. You're listening to Health Matters with Maury and Shannon. I smell the barbecue. We're live at Aquasuk Stadium
smell good, doesn't
on
it?
Fox Sports 1380.